G'day everyone, Stuart Hinds here from the Stuart Hinds Academy. About a month, maybe a month and a half ago, one of my subscribers from YouTube reached out to me with a question in regards to rebooking and dealing with and obviously attracting new clientele. Now, I'm only assuming, I didn't go into depth with them, but I'm only assuming that they were new to the industry and they were now looking at obviously accessing new clientele and how to go about rebooking. So this is a really important part of your first part of your journey. And I remember the first 5 years of me, like I'm in 35 years of practicing now, 5 days a week, and I know the very first part, those first 5 years were really difficult in terms of trying to work out my therapy, dealing with imposter syndrome, dealing with a whole range of insecurities about being a therapist and obviously providing good care. So you fumble your way through there. But I mean, as you move through those years and you start to get more confident in seeing things and doing things, then obviously that changes everything. Now, the question is really important because it really depends on the type of therapy that you're providing. So what I provide may be completely different to what someone else provides. My realm is working with active people, sporting people, athletes, whatever the case, amateur, elite, whatever, it doesn't really matter. They're active people. Most of those people may come into, they're not always active people, the majority of them are. A lot of those people that come in and see me are referred to me or they've come via word of mouth, 100% of the time usually, and they are suffering from something specific. Neck pain, shoulder pain, hip, knee, ankle, whatever the case may be. And so my realm is obviously, when they come in, is to assess, obviously, work out what their history is, treat them, and then obviously retest them and see where they are at. I am not in the relaxation therapeutic world, and so I can't comment about that world. I'm not actually in that world. I haven't been in that world. Maybe I started off in that world really early on in the place, and there's far more better therapists out there that can provide that sort of stuff. So I can't comment on that world. What I can comment on what I do with the active and sporting clientele and the specific people that come in for specific treatment. Okay, that's what I do. So in that case, I have over the years defined how I work with people coming in for specific conditions, okay? And so I've came up with what I classify as my 4 treatment rule, okay? Client comes in, has hip, knee, ankle, I don't care, whatever the case may be. Sit down, I take their history, try and work out a differential diagnosis, assessment, whatever the case, do my objective assessment, do my palpation, sit them back down and go, right, this is what I found, this is what I want to do, this is what I think's going on, and this is where I'm going to treat, and this is how I'm going to treat. So from that process, straight away, they know what's going on. And that's pretty much my informed consent as well, so they work out what it is. But what you also need to know is the fact that you're coming in to see me for something specific and you're asking me to deal with it and treat it, then what I need from you is a commitment of 4 treatments. Once a week for 4 weeks, and then we review after that 4th week. It's as simple as that. I'll know within 4 treatments if I can get a change. And that change has to be therapeutic. It has to be therapeutic. And what I mean by therapeutic is I need to change the frequency, the duration, and the intensity of their situation, okay? If I'm not getting all 3 of those, then I'm really not having a therapeutic change. And if that's the case, then obviously I may refer them off, or maybe I'm missing something, I don't know. So it's purely an individual situation. It varies from every person that comes in. But usually I can work out, especially within 2 treatments, if I'm going to get a change, if I'm going to be able to help them. And that's just the benefit of experience and seeing so much. And over that time, it's always been the same rule for me. 4 treatments. I don't need 10 treatments to work out what's going on. And in that case, obviously, we do a review, a mini review after each treatment, but it's really after 4 treatments we sit down and go, right, am I actually really making a consistent therapeutic change here? And if that's the case, then that's great. Maybe if they are better, because obviously there's 3 options that are going to happen. They get no change whatsoever, I make them worse, or I make them better. Okay, they're the three options. Okay, so each of those obviously mean three different things. If I get no change, it means the structures that I'm working on don't really impact what's happening with them. If I make them worse, that's okay. At least I know the structures I'm working with have something to do with what's going on, and maybe they're just a little bit more irritable than I thought so. And that is sometimes difficult to understand. I could do a whole webinar just on irritability itself. Okay, so even after 35 years, you think some people are going to be, oh no, they'll be fine with this pressure, but no, not always the case. And then obviously if we get a change for the better, then that's obviously what we're striving for. So it's really important in terms of if you are structuring yourself, you've got people coming in to see you for a specific treatment and you're working in that fashion, then you need to allow yourself a significant amount of treatment to see if you can make a change. And if you're not, look, sometimes I'm making a change enough to warrant some more treatment, but I may need to refer them off to someone else, physio, chiro, sports doc, whatever the case, podiatrist, osteopath, I don't care, whoever you choose. Once again, really individual. So it's really important that you do that. The other thing is too, which is a bit of my bear bug too. So in terms of the amount of clientele that I see, I don't like to be booked out more than a week, week and a half, 2 weeks. 2 weeks to do my head in. The reason for that is that because I work with active people and because people obviously approach me because they may have an overload situation, an injury, whatever the case, and that can happen any time. If they were to ring up and say to me, hey Stu, I've got a race this weekend, blah, 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 calf's gone, do you think you could fit me in? If I say that I'm booked out 3-4 weeks in advance, that's not going to help them. So I can't, so all of a sudden you distance yourself from people in acute stages of either niggles, injuries, whatever the case may be. So it doesn't allow you to get it at those times that you want to. And the beauty for me is that over the years I've been able to structure emergency spots during my week. Book out a long lunch, or finish, earlier on this day, don't book into there, or I start a little bit later on some days. So I have these emergency spots, and I've worked that out. I actually got that lesson from my GP, who said that's how we fit people in. And it's worked a treat for me, absolute treat. So I'm always booked out to that degree, but I always have spots available for people, okay? But sometimes that does get blow off. Then I've got to work back a little bit later than I need to. But given 35 years now, I've got it in a really good place. And it's the struggle between, I'm always busy. Is it busy good or is it busy bad, okay? So busy good is obviously, yep, I've got the load that I want, I'm seeing the people that I need, and I'm filling any gaps that I may need to. Busy bad is when I am overwhelmed. And that does happen periodically through the year, depending on the seasons and what's happening sport-wise, whether it's little ass, gymnastics, whatever the case may be. And it's always different. It is always different. So I think, from my point of view, how I don't also book out, months in advance as well is that I have an ever-revolving clientele going through. So I might see them once a week for 4 weeks. Then if they're good, then I boot them out 2 weeks. How are they then? Then I boot them out a month. So then bang, in comes the next client, and then the next client, and then the next client. So, people say, oh, Stu, are you still taking new clients after 35 years? I go, oh yeah, absolutely. Yeah, my clientele revolves, do you know what I mean? And yes, I do have a chunk of clientele and athletes that see me for maintenance. And once again, that's purely individual because you work out where are they at, what sort of sport are they doing, all those sort of things. And everyone's load's different and everyone's responses to load's different as well. So once again, so I suppose my take home for you guys is for those out there in the early part of your career and you're obviously wanting to know, oh, how do I rebook? What do I do? How do I say it? How do I structure it? By all means, take a page out of mine and set yourself achievable goals with your clientele. Make sure that they're aware of it. Explain it to them before you start the treatment, and and obviously engage with them. And so in terms of understanding of what you're doing, where you're going and what you're treating. Explain the change situation, explain the frequency, intensity and duration. They're the things we want to change. Because they're the things that you want to draw out of them for your next appointment. Okay, so they've come in. So, you've got Bob that comes in and he's got some knee pain and, it's been ongoing for about 2 weeks. It's just starting to really make a difference in him and he's having to back off either his load, whatever the case may be. So you sit down, you do your history, you go, look, how did it start? How bad is it? Have you had a history of it before? All the things that you need to do to draw out some sort of idea of what you think might be going on. Then you do your objective assessment, your physical assessment stuff, you do your palpation, and by about then you should know what's going on. So go, yep, look, you've got this knee problem here, these structures here, but I think your hip might be playing a role in it. So these are the things I want to do, these are the things I want to explore, this is where I want to treat, this is how I want to treat it. Are you okay with that? Do you have any questions? Good, no problems. So moving forward from out of here as well, we'll treat you today. Obviously we'll test you before you go, but really to make an impact and for me to really get on this and provide the care that I want to, I need a sort of commitment of 4 weeks from you, once a week for 4 weeks. And then obviously we'll do a review after that 4th week. And I should know within that time where we're at. And if I feel like I need to refer you off, then I will. If I don't, I won't. That's fine. Happy days. Bang, you okay with that? Do you have any questions? Do you have any concerns about that? Job done. That should just roll off the tongue and that's how it is. So everyone should be aware of what's going on and what your expectations should be. So I know it when you're at the start of your career and it is a little bit daunting as well because, part of you is still probably dealing with a little bit of imposter syndrome thinking, well, I don't know how good I am and do I really know what I'm doing? No, that's fine. We all go through that. Everyone's been through that. Anyone that tells you haven't been through that, well, they're just full of shit, really, seriously. So I hope this clarifies a little bit for you. I hope it gives you some structure and some understanding of how you may want to schedule. I'm not saying you do it exactly the way I do it, but I'm giving you an insight of how I do it, and that's probably the best way that I do it. And once again, as I said, what I am providing you is advice about a treating practitioner, and that's what I do. For a general therapeutic and relaxation, that is a different discussion with your clientele. So some of you may structure it, once again, it might be to do with just wellness. They want the well-being of it. Obviously, they're dealing with stress, emotional stress, whatever the case may be. And that would be something that you'd need to discuss with them on an individual basis again. And, to some degree, even a lot of the athletes I get, we get through that process, maybe we get them on top of whatever they were dealing with. And they go, Stu, how often do I need to come back? And I said, well, that varies from person to person, depending on what you're doing, your load, the sport, all that sort of stuff. Is it contact? Is it non-contact? Is it? So, some come and see me every fortnight. Some come and see me every month. Some see me a little bit every once in a month, so 1.5 months, So I've got people who come in and see me a whole varying scheduled times. And that, once again, has to come back to the individual, and that's how you work it out. And you can only do that via discussion with them, you know what I mean? So I haven't seen you for 2 weeks, I didn't see you for 3 weeks, how were you after that? We booted it out 4 weeks. Is that working for you? How's your load? How's your body feeling? All that sort of stuff. These are things you need to be asking before you work out how often you need to be seeing your clientele as well. But if they're coming in for a specific problem, by all means, schedule them in for regular treatments, whether it be 4, some of you might feel like you need 4, I don't know, that's up to you guys. It's about where you are. I've got 35 years of experience, so it's very different if you've got 5 years, so yeah. Anyway, I hope that helps you. I hope that clears out a little bit for you, and I hope that gives you some structure and understanding of how I go about doing what I do, and in some way that can help you guys. As usual, just be awesome at what you do. That's all you can do. All right, guys.